Neurology quiz number 15. What is the area postrema syndrome or APS? This is one of the core clinical features of NMOSD, a demyelinating disorder associated with aquaporin 4 antibodies. Aquaporin 4 receptors are highly expressed in the area postrema, or the vomiting center located in the floor of the fourth ventricle, a region which lacks a blood-brain barrier, leading to preferential entry of aquaporin 4 antibodies. This is a presenting feature in 10% of NMOSD patients, and the most common symptoms are intractable nausea, vomiting, and hiccups. Brain MRI shows hyperintense T2 and flare lesions in the dorsal medulla, which may enhance. Women, African Americans, and Asians are more commonly affected. Misdiagnosis as GI disease is common. Acute attacks usually respond very well to immunotherapy with IV solimedrol or plasma exchange. Subsequent maintenance immunotherapy with azathioprine or mycophenolate is required. Unlike the spinal cord and optic nerve lesions of NMOSD, lesions of APS show more inflammation than demyelination and necrosis, which may explain the potential for complete recovery with treatment. What is hypnic headache? This is a rare type of primary headache usually seen after age 50 and occurs only during sleep. It occurs at the same time every night and wakes up the patient from sleep. Headaches are described as dull but occasionally can be throbbing and pulsating. They are usually mild to moderate and can be bilateral or unilateral, last from 15 minutes to 4 hours, and occur on 10 or more days in a month for 3 months or more. Headaches are not associated with unilateral autonomic features, restlessness, or sensory sensitivities. Pathogenesis is thought to be related to age-related dysfunction of the suprachiasmatic nucleus of the hypothalamus. Differential diagnosis includes cluster headache, headaches related to sleep apnea, tumor headaches, giant cell arteritis, among others. Agents used for treatment include caffeine 100 to 200 milligrams, melatonin 3 to 12 milligrams, or lithium 200 to 600 milligrams given prior to bedtime. Indomethacin can also be used. What is the significance of the striational antibody found in myasthenia gravis? Some myasthenia gravis patients have antibodies that bind in a cross-striational pattern to skeletal muscle sections, or anti-striational antibodies. These antibodies react with epitopes on the muscle proteins titin and ryanodine receptor. Anti-striational antibodies are found in about 30% of patients with adult onset MG. In younger patients less than 50 years with MG, they are found in the presence of a thymoma. In older patients more than 50 years, there is no significant association with thymoma, although they are more common in this age group. The antibody may be found in 80% of patients with thymoma without myasthenia gravis.